Patau Syndrome is a rare congenital disorder caused by having extra copies of chromosome 13 in cells. Next, newborns with this syndrome may end up having more than 46 chromosomes in their cell. This syndrome will disrupt the development of physical and mental of babies. Pregnant women who are 35 years old and above have higher chances to have babies with Patau Syndrome. Patau Syndrome is not an inherited disorder and it happens randomly because of an error occurs in cell division. There is no cure for this syndrome. Next, 9 out of 10 babies who born with Patau Syndrome only survive for the first year. About 1 out of 10 babies who born with less severe symptoms survive more than a year. Patau Syndrome is also known as Trisomy 13. It is called as Trisomy 13 because affected babies have extra copies of chromosome 13. This syndrome happens randomly because of non-disjunction meiosis in cells. It is commonly termed as Patau Syndrome since it was discovered by Dr. Cleft. Next, we move to the symptoms of Patau Syndrome. First, cleft palate. Second, cleft lips. Third, extra fingers or toes. The other symptoms are small head, microcephaly, ears malformations, small eyes, brain defects, and weak muscles. Now we move to how to treat Patau Syndrome. Unfortunately, there is no cure for Patau Syndrome, but there are surgery and therapy options to treat the symptoms. The treatments usually focus on baby symptoms depending on how severe they are. For example, surgical correction can be done for certain abnormalities such as cleft lips or cleft palate. Therefore, pregnant mothers will receive counseling and support from doctors if their babies have been diagnosed with Patau Syndrome before or after birth.
Can this disorder be cured? It can't be cured due to chromosomal problem. This is the differences between normal karyotype and trisomy 13 karyotype. Most of baby die before birth or die shortly after birth. How was the disorder is inherited? Most cases does not inherited. It occur randomly during cell division. It can be non-disjunction, transcolation, or mosaic. Let's talk about non-disjunction. Non-disjunction is the failure of homologous chromosome to split apart during cell division. It can occur during meiosis 1 or meiosis 2. The left picture is meiosis 1 non-disjunction, while the right picture is meiosis 2 non-disjunction. Next is transcolation. It is unusual rearrangement of chromosome. It affects only 20% individual. Trisomy 30 syndrome are transmitted by a parent who is a carrier of a balanced rearrangement of genetic material between chromosome 13 and another chromosome. It is called balanced transcolation. Next is mosaic. Mosaic occur during mitosis. This means patient cells are mixed with 47 chromosome and 46 chromosome. It occurs only at 1% of patients. People who have Patau Syndrome with mosaic have less severe symptoms. How common is the disorder? Number of births that affected with Patau Syndrome is around 1 in 5,000 births. 9 over 10 babies that affected with Patau Syndrome die, while 1 in 10 babies affected with Patau Syndrome live.
Is there a certain race that Patau Syndrome most common in? Significant racial or geographic differences in frequency are not evident. Patau Syndrome can affect individuals from all different ethnic backgrounds. Is it more common in males or females? Patau Syndrome syndrome appears to affect females more than males. It is because most likely male fetuses do not survive until birth. Average lifespan of Patau Syndrome patients. The median survival age is 2.5 days. Only 1 in 20 children surviving more than 6 months. How is the family of a person with this disorder affected? The family is affected emotionally as they must always be prepared for any situation that might happen to their baby in the future. Doctors and parents often have to make difficult decisions about treatment. Parents also need to make a very difficult decision between making their baby comfortable and prolonging life through invasive surgery. What have you learned personally from researching this disorder? We personally learned to have depth understanding and gain more knowledge about the disorder as it really happens. We should also support the parents as they must be affected emotionally with the children's condition.
Interesting facts of Patau Syndrome. What is that? It becomes the third commonest autosomal trisomy. Most babies will have abnormalities in their body part. Most of them die early in pregnancy. About 44% of babies die after first month, around 69% of babies die after 6 months, only 80% of babies achieve their first year. Alpha-fetoprotein is a blood test. It helps pregnant women to check her baby risk in getting Patau Syndrome. Ultrasound can also detect it as early as 10 weeks of pregnancy. It often associates with advanced maternal age. The risk is very low to have another baby with it again in next pregnancy. Mothers who have gone through tubal reversal are ready to receive it. The baby's brain is usually the most acutely affected. Pictures of Patau Syndrome. Patau Syndrome is non-inherited genetic chromosomal aberration that lead to severe heart problems. So far, no treatment or medication are available to cure this disorder. The treatment just focuses in providing comfort and release to the baby. The only way to detect and prevent this disorder is by implementing prenatal diagnosis. Contact the genetic counselor if your pregnancy is diagnosed with Patau Syndrome. The process of abortion is recommended as its mortality rate is very high. Even though long-term survival is not expected, but all medical providers are always ready to help the babies achieve their full developmental potential. Thank you for watching.